Hello and good morning, and welcome to our 2021 Los Angeles State of Reform Health Policy Conference. My name is DJ Wilson, one of the chief singers and dancers here at this show, and I appreciate you being with us. We, of course, had all hoped and thought that we would be doing this in person together, and what an optimistic time that felt like back in May and June. And we're not out of the woods yet. Still kind of slogging through Delta now and whatever other variants may yet come at us. But the key thing is that we're all together. Obviously, it's a little metaphorical. It's harder to feel the energy of being together, but I can see it. I can see it from the folks who are registered, almost 300 of us last night. And I can see the people in the room here now with the fancy sort of technology that we get to use. I see the Justin Burrell and Christopher Vitt and Heather Brungart, Denise Cunningham and Christopher Lee and Ryan Hunter and the inimitable Dr. Tanya Dansky from Memorial and others. So thank you guys for making time to be with us. I appreciate it. If you are at your first State of Reform conference, or if this is your 10th, as may be the case with Dr. Dansky, which we appreciate, you know that we exist here, that we see our role as trying to bridge the gap between the world of health policy and of healthcare, to create these sort of safe tables where people can get together, have conversations about defining the problem and finding solutions, rather than sort of, spitballing each other on social media, as can sometimes happen. We try to create places where people can come together and really wrestle solutions to the ground as far as we can find solutions. And whatever those solutions are, we think that they require more conversation, not less. And so even if we don't solve every one of the world's problems here at State of Reform today, we're putting in the time together, and that is meaningful. Obviously, we want to be in person. We create these sort of safe tables in the in-person and conference setting like this virtual one, but we do it in different ways. And one of the things that underpins the ways in which we work comes from this really B-rated movie B-class movie from 1990 called Memphis Belle. And I was a 15-year-old kid back then. It was a sort of summer of 1990. We were just invading, or rather Iraq had just invaded Kuwait. And it was such a different time back then. But one of the things from that movie was a poem as those flyboys went on their 25th mission over Northern Europe. It was read as a prayer in the movie, but it was a Yeats poem in truth titled The Second Coming, a poem about how in World War I, the institutions and our leaders and our community had let ourselves down and stumbled into that catastrophe known as World War I, the Great War back then. And to read from some of those lines from Yeats, he says, "Turning and turning in the widening gyre, the falcon cannot hear the falconer. Things fall apart. The center cannot hold, and mere anarchy is loosed upon the world. The blood-dimmed tide is loosed, and everywhere the ceremony of innocence is drowned. The best lack all conviction, while the worst are full of passionate intensity." And I tee this poem up in part because it's always a great day if you can start with a poem, and Ireland's favored son, Yeats, is as good a place to start as anywhere. But if we were to think about our politics in the United States, sometimes, particularly at the federal level, sometimes it feels like we are a little bit too loud and a little bit too intense, and that is neither a function of right or left. That is just how our political system seems to operate these days. And so it's up to us in this metaphorical room today to try to find spaces to come together and ratchet down the conversation, ratchet down the pressure, rather, and focus on how we can work together to solve these problems. Because it is, after all, just us here in the great American Democratic Republic who are going to solve these problems. And so I think in terms of watching these problems and watching our government over the last few decades, I am left with one thing I think I know, and that is that things always move more slowly than they should in American politics, right up until the point at which they move more quickly than they should. And it's when things move more quickly than they should that maybe we get ourselves in a little bit of trouble. So I think when you think about state reform, we try to do we try to create the social infrastructure via these conferences where people can wrestle with these big ideas to the ground. We also do that through our reporting and our news at State of Reform. And the approach that we think of or that we use for our reporting and our content doesn't come from Yates or a 1990 film, but it comes from a 2005 film called Super Size Me. Super Size Me, of course, spawns the slow food movement, gives a name to the slow food movement, and reminds us that over slow food, rather than fast food, we can form bonds of community, bonds of family. We can build trust and relationship over slow food, breaking bread over a meal, and that actually fast food just can make the body sick. And when we think about our media and our political media today, we think that there are lessons there. We think that slow news helps build relationship, builds information, builds constructive conversations, and that fast news can make the body politic ill and sick. And so our content at State of Reform is really focused on being slow and unsexy. We're not a impression-driven revenue model. Our content, the revenue to support our content comes directly from you as attendees at our conference. So when you come and you show up here at State of Reform, either at the Burbank Airport Marriott or here virtually, you're not only engaging in a conversation with one another, but you're helping to engage in content and reporting and a new model of healthcare journalism for the other 364 days of the year. So your engagement is super meaningful, and you can see we're coming up on 2,000 stories here for the year. We're going to probably hit 3,000 before the year is done. To be able to pull all this off, you need 4 kinds of investment in State of Reform. And the first, I think perhaps most obvious, is we need sponsors to help us pay the bills. And Anthem has been one of our best partners for multiple years in Los Angeles, multiple years in California, and really multiple years across the country. We just can't say enough good stuff about the folks at Anthem. They have always pushed us to have broader, more multi-silo, more thoughtful, and more disruptive, frankly, conversations on our agenda at our conferences and throughout the rest of the year. So we appreciate that they have been with us. Blue Shield of California, and particularly the Promise Health Plan folks, back in the early days of the pandemic, Promise and the folks at Blue Shield said, hey, you guys just keep doing what you're doing. We'll figure out this virtual space, and we will continue to financially support you and underwrite you. And that kind of confidence and goodwill and wind in our sails will never be forgotten. We appreciate it, and they've kept us around even when the times were tough. And we, of course, have great major sponsors also. These are our next level sponsors, really the bedrock of so much of what we do. HMA and Aetna. HMA, of course, is one of the premier consultancies in the country. And if you read your email yesterday or even this morning, you may have seen that we are now part of HMA, which we'll have more to talk about in the future. Aetna, of course, Vern and his team are top of class in California. Beacon Health Options and HealthNet, just some of the best brands in terms of mental health and overall care coordination in Medi-Cal and throughout, particularly Medi-Cal, but also Medicare and other lines of business in California. Physicians Health Insurance, a mutual company that is not only covering claims, but they're also working on value-based care with partners like California Medical Association, who is doing just about as much as anybody, really more than anybody, to keep independent physicians up and going so that access to care remains high. And of course, it's hard to have a conference on LA area healthcare without LA Care being at the table. They're one of our major sponsors, and we're super proud to have John and Francisco and all of the folks there have their wind in our sails as well. So when you add in all of our other sponsors, our track sponsors and exhibiting sponsors, and you add in this sort of totality of brands, it's really an impressive group, and we're very honored and proud that they are standing with us to have this conversation. Second area of investment we need is that of our convening panel. And our convening panel is a group of folks who come together from a bunch of different silos who help us think through our agenda. They help us think through topics and speakers so that if you have an agenda like that which we have today with speakers from across the spectrum of California and Los Angeles area healthcare, you really have to curate those speakers. It's not something that, you don't just find the 55 warmest bodies on the side of the road. You got to really think about how they all come together and fit together. And our convening panel is just immensely important in our achieving success there. Third, if you're going to have folks speak, they got to show up and help out. And we have 55 speakers today. It's just such an impressive group of folks. These are the thought leaders working at the intersection of healthcare and health policy in Los Angeles. It's just about as good of a group of folks as you're going to find anywhere in California and of course in Los Angeles as well, at work on these issues. And then finally, as of yesterday afternoon, we had about 287. I think we've already surpassed 300 with metaphorical walk-up registrations this morning. So it's a good crowd. We've got most of them in the room here now. I see the numbers ticking up as people are getting kids dropped off to school and re-engaging in the workday. So thank you, everybody, for helping to make this happen. All right, without further ado, I want to jump into our morning keynote conversation. That is with Superintendent Kathryn Barger. She sits, of course, on the Board of Supervisors, was the chair last year in LA County when we were all going through COVID together, and has all of the scars and experiences to prove it. So, Superintendent, I see you're still on mute, but I want to turn you over. There we go. Turn the floor over to you to take it away, ma'am.
Well, good morning, and excuse my voice. This is a cold, so even with COVID, you can still get a cold. So I apologize. It's more painful for me than it probably is for you to listen. But I am so honored to be here to kick this incredible conference off. You are going to hear from some of the best and the brightest that Los Angeles County has to offer on all issues of healthcare, ranging from COVID response and recovery to behavioral health, something that's near and dear to me, to state and federal healthcare reform, something that is much needed. I've spent more than 30 years in county government, and the majority of those years were primarily focused on healthcare policy. I truly do recognize the complexities of healthcare issues and know the critical urgency of ensuring services are accessible to all. When I was reviewing today's agenda, I saw so many friends and familiar names who are at the top of their field. I want you to know that throughout my career, I have relied on many of you to guide and support the county's efforts to serve our most vulnerable residents. The county's health and mental health systems help so many people in need, but we don't do it alone. It is undeniable that our focus of the last year and a half has been battling COVID-19 pandemic. This has shined a brighter light on our role as a safety net. I want to recognize the immeasurable work of our Department of Public Health and our Department of Health Services. Both have been really at the tip of the spear in our efforts to respond to COVID-19. Public health set the bar for how we can live safely in our communities while ensuring we had the needed PPE, testing, and vaccine resources. DHS has tirelessly staffed our hospitals and clinics while also rolling out our community testing programs. We could have not gotten through this pandemic without their dedication and truly their collaboration. Los Angeles County is home to one of the highest rates of vulnerable residents in the nation, and we have witnessed devastating losses in our communities. The impact to our residents and families could have been far worse, if not for the work of our county departments and our partner agencies, clinics, healthcare providers, and organizations throughout the entire county. Everyone stepped up to distribute PPE and make sure testing was available. We all worked together to educate communities on how they could return to work and school safely without increasing risk of the vulnerable to their vulnerable family members and neighbors. We organized a robust vaccination program that prioritized those most at risk to COVID-19. While we still have work to do, we have one of the highest rates of vaccination in the nation. I'm proud of the public servants in all sectors and have been inspired each and every day by those who stepped up to serve. Meanwhile, we began this year with a sense of urgency and a renewed commitment to address homelessness by streamlining and expediting affordable housing and permanent supportive housing. As the coronavirus began to spread in Los Angeles County, we refined and sharpened our focus on how we can best serve our most vulnerable populations. Through the leadership of the state and collaboration of many of our cities, we implemented the Project Room Key initiative to secure hotel and motel rooms for people experiencing homelessness who are most at risk of grave suffering if they contracted COVID. That initiative helped protect older people and those with underlying health conditions from contracting COVID-19. We have also developed Project Home Key, an initiative to purchase these hotels, motels, and other buildings and turn them into long-term homeless housing as a much more permanent solution. I love our Housing for Health team with the Department of Health Services, which has played a critical role in these efforts, connecting high-risk individuals experiencing homelessness with housing and wraparound services. These efforts were launched in response to identified nexus between access to healthcare, chronic disabilities, and homelessness. Their work has been essential to support long-term supportive housing for those who have been at the highest risk of chronic homelessness. Excuse me, I'm going to take a sip of coffee now.
Take your time.
Perfect. Similarly, the county is taking bold steps to address the
Take your time. That's one of the challenges of our fall and our winter is that we're heading into potential high flu season and RSVs all over the place. And now the kids are all back in school. Everybody's getting sick with the crud and it's just going around. So it's take your time. Yeah. No problem. There you go.
All right. Taking a breath.
Yeah.
Welcome to my world.
Yeah.
I know. Sorry. Is there a doctor in the house?
We'd have to get some, have to turn ourselves into a telehealth platform here pretty quickly.
You hand me one of those. No, please.
Take your time, Supervisor. It's no problem. And, it's like, it's one of these things we're all going to have to go through this sort of reintroduction to the germ biosphere as we all get sick again in the fall and we all go back inside.
Thank you, DJ. I just took a lozenger. So, all right. And I didn't get a cold last year, so now I'm getting it twice as bad this year. So
that's right.
Similarly, the county is taking bold steps to address the mental health and substance abuse components of homelessness, something that I feel does not get enough attention. We continue to embark on innovative and long-term solutions to address the mental health needs of residents of all ages. During the pandemic, we have seen an increase in the need for mental health services for all our residents who have struggled with isolation, anxiety, and depression, something that I'm seeing on uptick, not only in LA County, but throughout the nation. The Department of Mental Health has maintained a 24/7 helpline to provide critical mental health support, resources, and referrals. Not surprisingly, the department reported a 50% increase in total calls. Excuse me. The county also partnered with Headspace to offer free collection of mindfulness and meditation resources to all Los Angeles County residents, and more than 50,000 members have signed up, including myself. For those suffering from significant mental health challenges, we are working to address the continuum of care and the ways these individuals first encounter county systems. Through the leadership of this entire board, several decades ago, the county launched the mental evaluation team, something that as a policy deputy, I worked very closely on. These teams pair a sheriff's deputy and a Department of Mental Health clinician to jointly respond to individuals suffering a mental health crisis. This program has been highly successful, which is why the county's commitment to this program remains steadfast despite the tough fiscal decisions resulting from the pandemic. It is my hope that we can continue to expand this vital program in the coming years, knowing the immensely positive impact it has had on the lives of those that we serve. We've also implemented the new therapeutic treatment bans, an initiative that builds out our mobile response teams to triage mental health needs and connect individuals with services in real time. We are working toward a new system where 911 calls that involve mental health issues are diverted away from law enforcement and toward the appropriate specialists, something that we find keeps them out of our jails. But unfortunately, we need to build up the inventory of beds in order to accommodate individuals that are in crisis. So this does effectively divert individuals away from the emergency rooms and into services that are tailored to meet their specific mental health needs. We are continuing to make critical capital investments in mental health services. We are in the final stages of our mental health restorative care villages. I'm so excited about this, which are being built on the campuses of county hospitals and have recuperative care mental health beds. These beds are essential to addressing our dire mental health crisis. Mental health is one part of our much larger delivery of healthcare services countywide. I would like to take this opportunity to recognize and give thanks to all our county healthcare workers, not only within the county, but also within our private system. Our healthcare workers truly are the heroes of the pandemic, and I truly appreciate their dedication. I can't say enough about how grateful I am to all the frontline workers in our county family and our private healthcare facilities and community clinics. Day after day, they showed up, risked their own health, and served our communities. And I look forward to hearing from many of you throughout the today, and know we will gain so much insight from your perspectives. We are grateful for you and truly do applaud your unwavering commitment to the well-being of our residents. Now with that, now that the coughing's over, I am happy to take questions. And I again apologize for this.
No apology necessary, Supervisor. We all have to have and offer a little bit of grace to make it through this time. And coughing is the least of our well, at least in this case, is the least of our concerns.
Thank you, DJ.
Yeah, so let me ask you first, and let me sort of first reiterate to our attendees, don't be shy about questions. I see Ilhan already has one up there. And not only post those, but as you post those in the text or chat box there, you can then upvote them to prioritize them. And I will tell you, a secret that we've learned is that questions beget questions. It's the same thing in the in-person space. The more questions that are asked, then the more questions that will be asked, so to speak. But Supervisor, let me ask you just kind of to take us back, to the March 2020, April 2020, when we were first kind of entering into this space, and we were doing the unthinkable, locking down the economy, and nobody would have said that was possible in January. What was that like, being chair of the board and trying to navigate some of these politics and challenges back in those earliest days of the pandemic?
Yeah, it was interesting because when we got the notice that a county up north was going into what they called shelter in place, we were told that we may be next. And I actually got a call from the mayor of LA stating that in fact it was being done and what were we going to do. So we sat down. When I hear shelter in place, that to me gets a little bit of panic. So we talked about how we were going to roll this out, because we literally had days to do it. And we wanted to call it something that would really emphasize the fact that because the virus was spreading so quickly, people were safer at home. So that's what we did. We put together a plan to encourage people to stay home and avoid any getting together parties and all, and only go out for essential services. And I have to tell you, it was tough. It was tough because we put together a list of businesses that would be exempt. And I would personally take calls from business owners that were literally on the verge of tears saying, if I shut down, I will not be able to reopen. And it was truly a difficult time threading that needle, recognizing that we had a virus that was getting out of control. And I worked, while I was a chair, I worked collaboratively with all my colleagues to make sure that we were all on the same page, because the only way this was going to work is we all spoke with one voice.
What about, it seems like in 2021 that as Delta has taken over so much of the United States and still is really running through a lot of communities, it doesn't feel like, LA County has been relatively well off compared to other jurisdictions in both California and in other countries or other parts of the U.S. rather. Do you have opportunities to sort of pat yourselves on the back as policymakers to say, collectively we're doing better than most, or is it just too much hair on fire trying to navigate all of this?
Well, I mean, I think that, what I tell people, and I know people in the medical field understand this, we didn't know about this virus and it was continually changing. The state was changing the rules. We had to adapt to them. We had debates over the fact that we were becoming more strict as it relates to some of the interpretations of what the state was requiring. I don't believe we pat ourselves on the back, and I don't think we should pat ourselves on the back, because at the end of the day, this is what our job was to do, to work with public health, to represent the constituents and make sure that we did everything possible to protect them. But, with the Delta variants and now with the debate over vaccinated versus unvaccinated, I think the most frustrating thing for me is it becomes so political. And, when I'm looking at my health, I have an incredible team around me that I know personally, I trust. And when I call my doctor and say, what do you think about the vaccine? And he says, get it when you can, I trust him. But politics is now playing a role. And so when you talk about hair on fire and the Delta variants is continuing in the community because it's hitting the unvaccinated. And I don't want to make it about, you're in this line if you're unvaccinated and you're in this line if you're vaccinated. I wish people would just follow, I hate to say it, but the science in terms of protection so that we can begin to really reopen in ways, that for some people will seem more normal. Because I get a lot of calls right now from people very angry about the schools requiring people to wear masks. And this has become a very emotional issue for people.
Yeah. Dare I say another emotional issue is when people get sick because they're unvaccinated and end up in the hospital. That's also an emotional issue. You mentioned the state, of course, as a partner, and sometimes as a good partner, and sometimes as a more complicated and nuanced partner. How would you say the relationship between LA County and the state of California is, not just on COVID these days, but also on mental health and other areas? How would you sort of characterize the multiple relationships there into kind of one understanding for us?
So on COVID, I will say that working with the state, and actually both the prior and the current administration, has been phenomenal. We have really worked together to address, needs as they come up, whether it be the testing, the vaccination. So it's been incredible. I think the frustration is that when the state would make an announcement, the governor would make an announcement, we would literally have a half an hour to basically pivot into what the state was mandating. Communication was lacking in the beginning, excuse me, but toward the end, we got better in communicating, and they understood that if they're going to make an announcement, we need to have time, because people always say, what did you learn during your chairmanship? I learned that people want consistency and clarity, neither of which they were getting in the beginning of the COVID. We were adapting to what the state said, but we were doing different nuances. So there was no consistency. And then clarity. Do you wear your mask outside? Do you have to wear your mask outside? When do you wear your mask? I mean, it was very frustrating to people, which even exacerbated the animosity they had toward public health, toward government, toward the state. On the mental health side, when I started with the county, if you went up to Sacramento and asked them to look at rewriting the definition of gravely disabled, or even looking at any of the mental health laws, no one would touch it with a 10-foot pole. You couldn't get anyone to do anything. Now, Sacramento is very engaged, recognizing that we need to look at what's going on with our mental health laws, and we need to adjust them to meet the needs of today. And so the cooperation we've had with Sacramento has been incredible. Dr. Sharon and I have met with Mayor Steinberg, who was very instrumental when he was in the state government of getting a lot of the mental health funding for incredible programs like the programs we're doing at our county hospitals. And urgent care, mental health. So we are working well with the state now on mental health. The one area I want the state to engage more on is an IMD waiver with the federal government, which allows us to get reimbursed for beds beyond 16 in facilities, which right now we can't. So we have a huge deficit of beds in LA County for mental health, and it is crippling our system. So I'm hoping the state will engage more with us on working with the federal government to lift that IMD waiver to allow us to get reimbursement in many of our facilities. And all of you, we built 5 different facilities with 16 beds in order to get around the requirement. That is not efficient. So we've been working around it. It's time for us all to get on the same page and recognize that we need to build capacity.
I want to get some of these questions in from our attendees, particularly ISIS and a couple others. But on this question of an IMD waiver and how you think about mental health services and delivering those services, it's one of the areas of direct care provisioning that the county engages in. Of course, regular healthcare services as well, physical healthcare services. How do you see, as a county leader, LA Care and managed care organizations in Medi-Cal? Do you see those as key kind of pieces to move around on your chessboard as you're thinking about building an overall mental health system? Or is that so separate that you really got to focus on the lane because mental health alone is complicated enough? How do managed care organizations fit into that thinking?
Well, I think that managed care organizations, especially LA Care, is a vital player on this, and we need to work collaboratively with them. I truly do believe that when you talk about mental health and you talk about healthcare, we should talk about parity. We shouldn't be having a debate over getting more research for mental health. People that are in crisis with mental health deserve to have the same parity as we do for health services. I believe LA Care is a vital partner in helping us roll out any increases we do on mental health beds, because for the most part, they are the key gatekeeper to health services in LA County. And I want to put health and mental health on the same playing field.
Isis Montalvo has this question about, she says, the pandemic has created the need for innovation in providing healthcare services and health services. How do you see mobile services continuing past this pandemic?
That is a great question. And I have to tell you, telehealth is, we're debating it now in terms of the successes and where we need to revisit as it relates to COVID, because we did a lot of telehealth. I truly do believe on taking healthcare out into the community. We have a program that's mirrored after what LA City did, and that is when we get a 911 call, if they're familiar with the place they're going, they send a doctor out and they see if they can treat the individual in the community versus having to transport them into the hospital. We're doing it up in the Antelope Valley, and it has been incredibly successful. So we're hoping to expand that out to divert people that don't really need to go into the hospital from having to go in. And so I think it's a wave of the future, and it's something that I'm excited to see us look at doing. We're doing it with vaccinations. We go out into the community and we're doing mobile vaccination units. So we know it can be done. And especially in hard to reach communities like mine in the 5th District up in the Antelope Valley, you've got incredibly rural areas. So I think it's important for us to move healthcare out into the communities.
Christopher Vitt asks and says, first, Supervisor, you mentioned how the pandemic has highlighted that there is a large portion of the population that doesn't trust the medical community's advice regarding things like vaccinations. So are there any plans or ideas for how to strengthen public trust in the advice of the medical and scientific communities in the post-pandemic era? Maybe put a little differently, how do you think about this idea of public education around these complicated politicized healthcare topics?
And I struggle with this because I talk to friends who, that feel that, this has become like a political football for many. Who's blaming who for not trusting the vaccine? I think we need to get the politics out of it and let the healthcare policy move forward and really drive the educational process. Because I think if I tell people it's safe versus, my doctor, Dr. Pachorik, if Joe Pachorik goes out in the community and says, I want all my patients to get it, he's got more credibility. And I'm okay with that. But I think we need to recognize that there is a lack of trust in government right now as it relates to COVID. And we get the calls every day, and it's very, very, very heated. But I do struggle with this, and it's something that I truly think is unfortunate. And as chair, I started to deal with the political climate where Washington was pointing fingers, and saying that we're all trying to undermine, when in fact we were all in this together trying to get it done. And it was very frustrating. And I think we're now seeing the fallout of that.
Yeah. Ilan Shapiro asked a question that you've kind of already addressed. He asks, are there plans to help community clinics continue telehealth and preventative services? You've sort of spoken to that already, and you're interested in supporting community, but maybe talk more about how you see these community clinics playing an integral role in terms of the safety net in LA County. Just your thoughts there.
Yeah, I mean, and I say this, and I'm only one of five, but I can just speak for myself, both as a supervisor, but also in my prior life as a public health officer, or public health policy officer for the prior supervisor. Community clinics play an unbelievably important role in our healthcare system in LA County. And quite frankly, and I know they know it, without them, our system would collapse. They are an incredible partner. And I believe that we need to continue to expand and increase our community clinic services, especially as it relates to getting it out into the communities. And I believe they're better equipped to do that in real time. And so, I look forward to lessons learned from COVID, how we can provide healthcare better, and how we can partner to really support one another. But community clinics for me are a no-brainer.
I ask this question sometimes in private conversations, and since this is our first conversation together, it says private or public, as it might get. Some public officials understand healthcare. You clearly do. Some have less of an understanding. And so how do you work to bring people along? How do you work to educate them without being condescending and all of that stuff? Not that you would be, but it's sometimes it's complicated. How do you work to bring people along on a very complicated subject that is highly politicized, but yet, you got to work across political divides to be able to do it?
I think that one's going to be debated for a long time. And I'm kind of old school. I'm very proud to say, I don't know. I'm going to go to the expert. I don't know everything. And I tell people I know every other thing, but I don't know it all. And I really, as I said in the beginning of my opening remarks, there are people probably on this conference that I've reached out to help educate me on issues. Because in order to really understand how the policy impacts the system, you've got to talk to the people that are at the line doing it. And I think in public policy, especially in government, we tend to not recognize that actions have consequences. So it's important to bring the experts into the system for the debate in order to put together a policy that makes sense. And, I think that people trip over themselves, and I said it with mental health. Now you've got people writing competing legislation in Sacramento that, if it all passed, might not yield the benefits that we all want. We need to collaborate together, and it shouldn't be about who can be able to take a bow. I tell people there's plenty of room in the tent for everyone to take a bow. I don't care if I get the accolades. I just want to get it done. But I look to our healthcare providers on the front line to really help educate me. And I can only speak for myself. And I did healthcare policy for a long time, and I still have a lot to learn. I mean, it's ever changing, especially as it relates to what's going on in Washington and even at the state in terms of how we're rolling out universal healthcare.
I know we're getting short on time, so let me ask sort of this question about counsel to our group. Our audience is a pretty senior group of healthcare executives and health policy leaders. If we're going to be in COVID, some period of COVID for another year or 2 or 3 or 4, however many years, and if politics in the American Democratic Republic still exist over that time, which I'm sure it will, how can our community inform, support you, put wind in your sails as you continue to try to navigate this, the politics of this pandemic?
Well, I tell people COVID is here and we have to learn to live with it. And I think that is the reality. Anyone that says, it's like, if I were to tell you, DJ, that in a year, I'm going to eliminate homelessness, that is not realistic. I'm not going to tell you that in 2 years, COVID is not going to be, or it's going to be completely gone. I think we need to learn to live with it, and we need to speak with one voice, and we need to trust people and educate them. Because, I think that some of the people that are anti-vax right now don't want government telling them what they should do and what they shouldn't do. And I was talking to someone who actually was vaccinated, but didn't want to tell their employer they were vaccinated because they thought it was none of their business. I mean, we've become a country that is so defiant and doesn't want government telling them what to do. So I look to the industry to be our voice and educate your patients as they come in that this is not a political issue. This is a healthcare issue, just like it would be if a patient came in with chronic asthma or with diabetes. You would treat that, help them, educate them, tell them what they can do to control, the diabetes and the asthma. We need to educate people on how they can control this virus in the community. One way is getting vaccinated. The other way right now is, quite frankly, wearing a mask. And I think that is the reality. I think moving forward, we need to embrace that and speak with one voice and work together. But again, I don't think it's going to be the political side that is going to get through to the public. I truly do think it is our healthcare service providers in the community who are trusted and respected.
Supervisor Kathryn Barger on the Los Angeles County Board of Supervisors from the 5th District and chair during the 2020 launch of the pandemic. Ma'am, thank you very much for making time. I appreciate it.
See, now I'm not coughing. Thank you.
Well, see, you hang out with us and you get healthy. That's how it works.
Thank you. Thank you all. Again, thank you for everything you do.
Yeah, thank you, Supervisor. I appreciate it.